Greetings, dear learners. We were learning the snake poisoning under the animal poisons. We learned up till now the poisonous and the non-poisonous snake, their differences, and certain preventive measures from the snake bite. We also saw the different types of the snakes. I could not show you very individually the different features of the different snakes, but it is the part of the your long term understanding that how to differentiate different types of the snakes according to their individual features and by their appearance. This you must go through. I will be sharing the reference. You can go through those references and you can learn more details about the snakes. Today we will learn about the remaining aspects of the animal poisons, including the remaining things about the snake poisoning. Snake poisoning, as we already discussed, a snake is venomous. It contains the venoms. We already saw in the last class the picture of the how the snake bite occurs with the and the release of the venom occurs. So, snake venom is a complex mixture primarily composed of the proteins, making it up over 90% of its content. These proteins includes the various enzymes, toxins and non-toxic components like carbohydrates and metals. Enzymes found in the venom plays the very important role from aiding in the digestion to inducing blood clotting and the tissue damages. Additionally, polypeptide toxins disrupt the nerve functions at the neuromuscular junctions. Venom compositions can vary widely between the snake species and even within the same species due to the factors like the age, season, and the geographical locations. This variation can influence the severity of the envenoming and the effectiveness of antivenom treatment. The amount of venom injected during a snake bite varies depending on the factors such as the species of the snake, the mechanism of the bite, and the size of the snake. Interestingly, some snake bite may not inject enough venom to cause any toxic effect or any harm. That is termed as the dry bite of a snake. It is essential to note that snakes retain their venom even after the multiple strikes and feeding, maintaining their potency. So, a snake can cause the multiple bites, and even more than the multiple persons may be involved with a single snake bite. So, this must be kept in the mind. This is the list of various enzymes that are present in the different snakes that causes the effect on the body. Then the pathophysiology of the snake bite. Envenoming from the snake bite can cause the various local and the systemic effects. Swelling and the bruising occurs due to the venom components increasing the blood vessels permeability that can lead to tissue death if blood clotting is disrupted. Hypotension and shock may result from the blood leakage or widening of the blood vessels, affecting blood pressure and the clotting processes. Neurotoxicity manifests as a paralysis, particularly affecting the muscles involved in the breathing, which can be life-threatening. Myotoxicity caused by the venoms damaging muscles that can release the harmful substances leading to the kidney damages and the weakness. Acute kidney injury can occur directly from the venom or as a reaction to the antivenom, causing the various kidney problems. Some snake venoms can increase blood vessels leakage, leading to systemic issues like lung swelling, possibly due to blood vessel wall damage by the venoms. In this way, the snake venom acts on the body and producing the different signs and symptoms. As we already talked, the period that is involved in the blood coagulation profile derangement that leads to the hemorrhages and the shock and hemorrhages, hypotension, and whereas the lepidi that is more commonly involved in the neurotoxicity, so they will be having effect on the nervous system and the paralysis. And the myotoxic like the sea snakes, they have the toxicity, myotoxicity. They may cause the myoglobinuria and the renal failure. Like those ways we can approximately classify different types of snakes. Then the symptoms and sign seen in the snake's bite, the puncture mark that will be seen at the site of the bite can be caused both by the venomous and the non-venomous snake as well as other animals. Dry bites could be possible that there is no sign and symptoms after those bites. Then the local symptoms that will be produced at the site of bite, that is the one part of the snake bite problem, that will have the pain at the site of the bite, that may be the transient to persistent and can be accompanied by the swelling. Swelling can spread proximally from the bite site and may lead to complications like necrosis and infection. Then there can be bleeding and bruising underneath the bite site. Local bleeding and bruising can occur along with inflammation, blistering, and abscess formation. Necrosis of the tissue occurs at the site of the bite. Then, apart from the local symptoms, the body may have the systemic symptoms according to the venom composition. General symptoms that are presented by the patients, that is the out of the fear and anxiety of the snakes, that may be the fear, anxiety, nausea, vomiting, malaise, abdominal pain, weakness, drowsiness, prostration, and many times even the snake is non-venomous. The patient may go into the shock, neurogenic type of shock, and he may collapse to death. In these cases, a snake envenomous doesn't have much role or much effect. So the patients being bitten by the snake must be calmed down first, should be relaxed from the anxiety. As we already know, the majority of the snake bites are the non-venomous bite. So this must be kept in the mind while treating such patients. Then other effects on the body can be the cardiovascular effect that includes the visual disturbances, dizziness, faintness, shock, hypotension, cardiac arrhythmias, and the myocardial damages. Increased capillary permeability can lead to facial and conjunctival edema, parotid enlargement, pleural and the pericardial effusions, pulmonary edema, and the albuminuria. Bleeding and clotting disorders may be in presentation in the patients, that may be traumatic and spontaneous bleedings, cerebral arterial thrombosis. Then neurological effects may present with the ptosis, ophthalmoplegia, paralysis, rhabdomyolysis, acute kidney injury, and acute pituitary insufficiency. Then in the case of the unknown snake bite, particularly where the type of snake is not known, in those cases, for the practical purpose, we divide the snake bite as a syndrome. Different categories of the syndrome classification are done, and accordingly, the management of the patients are started. So, this is the syndromic approach for the management of the snake bite cases. Here, the syndrome 1 is the local envenoming with the bleeding or the clotting disturbances. This is particularly associated or suspected to be a case of Epriadi. So the management line for the syndrome 1 is defined. So you have to see whether there is a local envenoming with the bleeding or the clotting disturbances. Then you have to start the management accordingly. Then the syndrome 2 is the local envenoming with the bleeding or the clotting disturbances, shock, and acute kidney injury. Then this is probably the case of the Russell's viper. So apart from the clotting disturbances, here the symptoms are more prominent, shock and the acute kidney injury is there. So you have to manage it accordingly. Then syndrome 3 is the local envenoming with the paralysis. So it is suggestive for the neurotoxic snake bite, probably the cobra or the king cobra. So you have to manage that according to the syndrome 3. And the syndrome 4 is the paralysis with the minimum or no local envenoming. That can include in case of the krait on the land and the sea snakes in the water, Australian elapid in the Indonesia. If you are finding a bite, incidence of the bite, and there are the minimum local envenomation or the local reaction, and the patient is having the signs of envenomation, that is highly suggestive of the krait bite mark. And also the bite site in these cases are very faint or the not clearly visible, in particularly due to the small teeth structure in the krait. So this must be looked upon. Then the syndrome 5 is the paralysis with the dark brown urine and the acute kidney injury. That is highly suggestive that it is the myoglobinuria, that is musculotoxic snake some is there. So accordingly, we have to manage the patients. So this is the syndromic approach for the management of the snake bite cases. Then the long-term complication with respect to the snake bite, at the site of the bite, there could be the necrosis as we already saw. Then the tissue loss, chronic ulceration, infection, osteomyelitis, arthritis, and the scarring could be possible. And the systemic chronic effect could be chronic kidney disease, panhypopituitarism, chronic neurological deficit, and the psychological morbidity. In case of sea snake envenoming, the symptoms include headache, tongue thickening, thirst, sweating, vomiting, muscle aching, stiffness, tenderness, trismus, paralysis, myoglobinemia, myoglobinuria, acute kidney injury, and the hyperkalemia. These are all features seen in cases of the sea snake envenoming. You may remember it as a musculotoxic. Usually the sea snakes are musculotoxic. So features are similar to that. Then the cobra spit ophthalmia, that is usually seen in case of the spitting cobra which spit its venom and injects into the eyes. In those cases, the person will present with the intense burning pain in the eye, stinging pain, watering of the eyes, conjunctival congestion, eyelid spasm and the swelling, photophobia, clouding of vision, temporary blindness, corneal ulceration and a scarring in the eye may occur. So these features are seen when the exposure is on the eye side. Then here the picture is showing the different types of the bite mark. This picture is of the venomous European adder snake. So you can see the two puncture marks. This is the typical of any snake bite site. Here this is the western Russell's viper. This is another two multiple bite marks is there. Then this is the non-poisonous snake bite mark, that is the water snake bite mark. Here the red bite mark is, you can see here, this is the animal bite mark. This is the spider bite mark, Brazilian wandering spider bite mark. So you can see the gap between the two bite sites. This is the individual sting that has been punctured. So this is not the snake bite that can be observed here also. Then this is the catfish bite mark. So in this way you must be able to differentiate different types of the bite mark, and you must be able to judge by the bite mark pattern different types of the animals that has caused the different patterns. Then coming to the diagnosis and management of the snake envenomation. So the history is very important. You should take the proper history of the time and place of the bite, and then activity at the time of the bite. You should examine then the bite site. You should look for all the puncture mark and all the local sign and symptoms. Then you must try to find the type of species that has caused this bite. The patient or relative may directly identify the snake, or a killed snake or his photograph may be brought by the patients or his relatives. So in this way it is very clear that this particular bite has occurred because of that this is a snake, and you can appropriately plan accordingly. Then importantly, as we already discussed, that you should not rely with the relatives or the patient's statement. You should always ask the patient to wait in the waiting area and observe for the changes or the symptoms of the envenomation. If there is envenomation, you should start the treatment accordingly. Then the third scenario could be that the snake is not identified. In those cases, you should take the syndromic approach of the management. You should look for the syndromes and you should manage accordingly. Then you should go for the systemic examination and the investigations. The investigations in case of the snake bite may include the hematological parameters. Under that, the white blood cell count, there is an early increase in the neutrophil count that suggests the systemic envenoming. Then the platelet count, there is decrease in the platelet count that may indicate for the thrombocytopenia. Then hematocrit value, that may rise due to the hemoconcentration or may fall due to the hemolysis or the blood loss. Then you should look for the signs of hemolysis, that may be the presence of the fragmented red blood cells, that may be cystocytes, and helmet cells may be seen on the microscopic examination. Then the clotting and the prothrombin time may be prolonged. Partial thromboplastin times, that also tends to be prolonged. Fibrinogen levels shall be checked. Usually in case of envenomation, fibrinogen level depresses. Then fibrin degradation products is elevated, that may indicate of the coagulopathy. And one of the very important hematological test in case of a snake bite is the 20-minute whole blood clotting test. This is usually useful in case of viper envenomation. It is the diagnostic test for the viper bite. To perform this test, an unclotted blood sample after 20 minutes suggests the hyperfibrinogenemia, that is suggestive of the viper envenomation. So this is the very important test to detect the viper envenomation. That is the 20-minute whole blood clotting test. Then apart from the hematological changes, we may look for the other changes like ECG. ECG may show bradycardia, ST segment elevation or depression, T wave inversion, QT prolongation, and alteration due to hyperkalemia may be observed on the ECG. Then aminotransferases and the muscle enzymes that may be elevated, that suggests the muscle damage commonly seen in the bites from the sea snake bite, that indicates the bites from the sea snake, crate, and the Russell's viper. Then ABJ and the pH analysis may also be deranged. Respiratory failure and the acidemia may be evident, indicating neurotoxic envenoming. Respiratory and the metabolic acidosis may also be the finding. Then there is certain other metabological derangement like hyperkalemia, hypoxemia, and the metabolic acidosis may be seen. By these findings, we may approach for the management of the snake envenomation. So, from the history to the local examination, then systemic examination, then the laboratory examination, we came to the conclusion that there is the systemic envenomation and the problem is happening with the patient. That is indicative the snake is poisonous and we have to start the treatment. So, the general guidelines for the management of the patient that include the first aid treatment, that is the initial treatment given at the home itself. You may apply the Savlon or the antiseptic lotion over there. Then transport to the hospital. You have to bring the patient immediately to the hospital. Usually earlier literatures were saying that you have to tie a hard knot over the just above the bite site to obstruct the flow of the blood flow to above the area so that the venom will remain localized to the bite region. But these are not recommended anymore because this normally the ligature that we are putting doesn't obstruct the arteries, they just obstruct the venous drainage. It is no more recommended as it may occlude the both arterial and the venous supply, that may cause the necrosis of the local tissues. So it is no more recommended to tighten the ligature just above the bite site. Also, it is no more recommended to give incision or sucking of the venom from the bite site. These are all harmful and they are of not of much benefit. So, you should not perform these techniques at the site of bite. What you may do is to let the patient lie down and over the stretcher or any of the bed, and you try to immobilize the limb over the which the bite has happened, and you apply the Sutherland wrapping technique of the ligature. You may roll over the ligature material just above the bite site with a little space or the pressure like the a finger can be allowed, and the way you apply for the spigometer cuff, in the same way the space that allows a little bit of the pressure to expand so that it should not exert much of the pressure but it should have a balanced pressure. Like that way the Sutherland ligature or the Sutherland lappings may be applied from the site of incidence, and then immobilize the limb and bring the patient to the hospital. Then at the hospital, rapid clinical assessment shall be done and the resuscitative measures shall be undertaken. Detailed clinical assessment and the species identification shall be done to make the diagnosis of the envenomation. Then the investigation and the certain blood test and the other tests that we already talked shall be done. Then according to the science of the systemic envenomation, we should give the antivenom treatment. So antivenom is the main crux of the treatment in case of the snake bite. Then after giving the antivenom, you should observe the patient for the response and then decide whether to give the further doses of antivenom or not. Then the supportive or ancillary treatment according to the patient's stabilization or not stabilization. Then the treatment after the patient has survived, then the treat the bite-in part and the rehabilitate the patient's treatment of the chronic complications, and finally advising to avoid the future bites. All these should be a systemic approach and it should be done in a proper hospital environment where all the facility of the complications management and everything is there. It is for general public awareness that the patient shall not be taken to any of the magic remedier or any claimant who claims for some magic or mantra for the treatment of the snake bite cases. The patient shall not be taken to such places. It is highly risky Usually these people take the advantage of that most of the poison snakes are non-poisonous. So majority of the bite cases, or even the many of the cases, are the dry bites. So in those cases, usually the patient doesn't have much of the complications or the any of the problems. In those cases, the normally itself the patient will survive. So taking those places will land up in the danger if it is the proper venomous bites. So such person will not be able to do any of the remedies or any of the help if the snake is dangerous. However, in the medical science, we have with the anti-envenomation, there is a highly better chance of survival in cases, even in cases of the poisonous snake. So the patients should be brought to the proper hospital where the antivenom treatment facility is available. They should not be taken to any other place where the antivenom facility is not available. So under the first aid measures, reassure the victim. As I already told you, that reassurance of the victim is very important, as the patient is already in the shock or may undergo the out of fear or anxiety. So the most snake bite are not venomous or lethal, but the anxiety can be dangerous that may lead to the neurogenic shock. So the patients shall be reassured and stabilized. Keep the patient still, immobilize the bitten leaf using the splint or the sling to prevent the venom spread. Get to the hospital as soon as possible. Use any available means of the transport like a stretcher, car, or even carried if necessary. Avoid certain drinks like coffee or alcohol that worsen symptoms, so avoid them. Use tourniquet with a very cautious. Only consider if medical help is very far away, and for the specific snake bites, apply loose band above the bite site. Skip incisions and the suction. This method can cause the more harm than the good. Also, the cooling with the ice is no more recommended, as cooling the bite area can lead to the tissue damages, so it should not be done. Avoid electric shock. It is not helpful and can be dangerous. For immediate pain relief, paracetamol can be given. Avoid aspirin and anti-inflammatory drugs. Tetanus toxoid injection may be given if needed. Then once the patient is in the hospital, then the hospital care shall be undertaken. Observe the patient for at least 24 hours. Monitor the vital signs, urine output, bleeding and other symptoms. Even if there is no symptoms, you should at least observe the patient for the 24 hours. Check for abnormal bleeds, local swelling, kidney issues, breathing problems and the muscle damages. Then if there is a systemic envenomation, then sign and symptoms, then you have to administer the antivenom. Give antivenom if there are signs of systemic envenoming like vomiting and the persistent bleeding. This is important to know that when to give the antivenom treatment, as antivenom itself can be the very dangerous and toxic. So antivenom use shall be done very cautiously. Also, the if the particular snake species has been identified, so if we have availability of that antivenom for that particular snake, that will be very useful. However, in India, we usually have the polyvalent antivenom that contains the four snake that is commonly occurs in the India. There is also coming the bivalent antivenom. So if we are sure that this particular snake bite has happened because of this particular snake that is coming under the bivalent antivenom also, so it is better to give the bivalent antivenom, because the toxicity that can be produced by the other two snake antivenom, that can be lethal for the patient itself. So many patients who are not dying out of the venomous bite mark may die of the antivenom treatment. Many of the toxicities due to antivenom like pulmonary toxicity, which all can cause chronic complications in the patients, and over the long term that can be very fatal for those patients. So antivenom treatment shall be done very cautiously. The indications for the antivenom treatment startment are the vomiting, persistent bleeding from the bite mark site, discolored urine indicating the hematuria, neurotoxic symptoms like the sleepiness, drooping of the eyelids, blurred visions. These are all indicative of the systemic envenomation. So you should start the antivenom if these symptoms are there. Then you must have the availability of the antivenom. I already told that usually in India the polyvalent antivenom is available that is effective against the common cobra, common crate, Russell's viper, soy scale viper. Because this polyvalent antivenom is made from these 4 snakes. These 4 snakes are called big 4 in India because most of the snake bite occurs in India because of these 4 snakes only. Then you must know the source of these antivenom availability. So usually this is produced in the Biological Evans Limited, Hyderabad. And how to administer the anti-snake venom? It shall be administered intravenously. As already we discussed that after giving the one vial, we must wait and look for the improvement and accordingly decide the number of vials that need to be given. Usually in case of the Bengalas ceruleus, 10 to 20 vials of the antivenom is required. For the Naja, it is 10 to 20 vials is required. For Daboia or Vipri lacilli, 10 vials is required. Icus carinatus, 5 vials is required. So in this way, the different dosing pattern you should know. Then here you can see the picture of the snake venom antiserum, that is lyophilized. This is polyvalent, enzyme defined, equine antivenom immunoglobulin fragment. And in the ingredients, you may find the different types of snakes from whom the snake venom has been prepared. So these are the big 4 snakes from which the polyvalent anti-snake venom is prepared. This is soy scale viper, this is the cobra, this is the Russell's viper, and the common crate. That is the commonest these 4 snake in India. That is most of the snake bite in India occurs because of these 4. So this antivenom is effective in case of bite by either of them. Then after giving the anti-snake venom, there can be certain anaphylactic reactions like itching, urticaria, dry cough, fever, nausea, vomiting, abdominal colic, diarrhea, tachycardia, pyrogenic reactions, chills, fevers, hypotension, late serum sickness reactions, fever, itching, arthralgia, lymphadenopathy. These all should be managed with accordingly hypertensive reactions management, hydrocortisone and the adrenaline injection. And this antivenom is contraindicated or used with cautions in the sensitized individuals. Pre-treat high-risk patient with epinephrine, antihistaminics or the corticosteroids. Then additional measures that includes the treatment of the beaten part. Once the patient is stable, then you should manage for the treatment of the beaten part. Keep it comfortable and avoid excessive elevation. Aspirate blisters if necessary and watch for any infection and manage for the chronic complications of the beaten sites. Then once the patient is out of dangers, then you should keep in mind about the complications and you should treat accordingly about the complications related with the snake bite. That can be coagulation abnormalities corrected by antivenom therapy or the administered flesh blood products as required. Then for the management of hypotensive shock, use the plasma expanders if necessary. Consider vasoconstrictors like dopamine. In case of renal failure, monitor the urine output and manage conservatively to avoid dialysis. Then hyperkalemia shall be treated with the calcium gluconate, dextrose in insulin, sodium bicarbonate and the beta-2 agonist. These are already very well known to you. Then neurotoxicity shall be managed. Consider anticholinesterase drugs like neostigmine for the cobras. Respiratory supports, maintain airway. Consider mechanical ventilation if required. Prevent rhabdomyolysis. Maintain hydration and monitor urine output. These are all important to prevent the further complications in the snake bite cases. Also complication due to the anti-snake venom treatment. So all those things shall be kept in the mind while managing the patient of the snake bite. So this is very brief facts about the snake bite cases and their management.